It's World Autism Day and April is World Autism Month. The brain disorder affects over 67 million people around the world. So why is autism still so poorly understood? This is Inside Story. Hello and welcome to the program. I'm Hashim Ahalbara. The US-based Center for Disease Control describes autism as a developmental disability that can cause significant social, communication and behavioral changes. Monday marks World Autism Awareness Day to highlight the issue in different countries, but autism is still misunderstood. Some see it as a psychiatric illness or even bad behavior, but it's one of the fastest growing brain disorders. It affects 1% of the world's population. That's an estimated 67 million people. The causes are still being investigated, but many experts have come to the conclusion that a combination of environmental and genetic factors play an important role. The condition is a spectrum, which means there's not one type of autism and it can affect people in different ways. Symptoms can include patients being trapped into their own mind, suffering difficulties with communication and social interaction. Although it can't be cured, it's believed that early intervention can greatly improve symptoms. But when it comes to treatment, many countries are still lagging behind. We'll get to our guests in a moment, but first, this report from Natasha Butler in Paris.
When Hugo was 2 years old, his parents discovered that he had autism, a condition that affects behaviour and communication. Doctors told the couple to place their son in psychiatric daycare. Psychologists blamed them for his behaviour.
Psychologists who say you're making things up, or it's your fault, or that you've caused this condition because you've loved him too much, or not enough, you breastfed him too much, or not enough. We need to get out of this psychoanalytical approach.
Today, Hugo attends his local school with a carer, but that's rare in France, where most autistic children have no access to mainstream education. On Saturday, families marched in Paris. They say the French state's treatment of autistic children is shameful and they want change.
Putting children in psychiatric hospitals has to stop. It makes families suffer and the children won't develop.
Campaigners say that France is around 50 years behind countries like Britain and the United States when it comes to diagnosing and treating autism. And one of the big reasons they say for that is that France still focuses very much on ineffective psychiatric treatments instead of educational and behavioural therapies.
But psychiatrists say that they have an important role to play.
When it comes to autistic children, you'd have to really ignore the facts to say that they are not suffering. When people tell me autism is just another way of being in the world, or just a different type of intelligence, it really trivializes it.
Mohamed Sajidi was so fed up with the lack of support and options in France for his son Sami, he set up his own school. The emphasis here is on behavioural therapy and integrating children into mainstream school and society.
The new government must decide to break with the old system and create a new public health strategy for autism. That means extra money, new training and new methods, which some of us in France are already using.
The United Nations recently condemned France for violating the rights of autistic children. The government says it's taking the matter seriously. It's preparing to launch a new autism action plan this month. But few people here dare to hope that it will provide the support and financial help they've been waiting for so long. Natasha Butler, Al Jazeera, Paris.
Let's bring in our guests. Here in the studio, Husna Awaida, a mother of a child with autism and a doctor who has researched the disorder. Joining us on Skype from Baltimore, Margaret Daniel Fallon, Chair of the Department of Mental Health at Johns Hopkins Bloomberg School of Public Health. And also here in Doha, Fuad Al-Shaban from the Qatar Biomedical Research Institute at Hamad bin Khalifa University. Welcome to you all. I would like to start by asking Margaret, this is World Autism Day, and many people seem to struggle with the notion of autism. How can we explain autism? What is it?
Well, I think your description at the top of the show was really a quite good one. Autism is a very, very different disorder amongst people affected by autism spectrum disorder, but they all come together in the sense that there's some limitation in social interactions, in abilities to communicate, and often in repetitive and stereotypic behaviors.
Mr. Shaban, there have been many theories in the past over the cause of autism. Do we have an established reality or truth about what exactly causes autism?
Well, actually, till now, the interaction between the genetic factors and the environment factors still play a part in this disorder. So it's a heterogenic disorder. Many genetics, many genes are involved, and also there are so many environmental factors affecting this condition, and that's why it's on the increase for the past 20 years.
Husna, you are a speech therapist, but you're also a mother of a child who is an autistic. Yeah. What was the most difficult part for you dealing with a child who has autism?
Dealing with a child. The most important difficulty for us and challenge to find a good place for him to learn and to try to make him get used with his disability, and to try to make him overtake it and trying to solve this problem, because in the society nobody supports us, and also we're trying to find a good place in the school, and to try to find a program which is good for him.
So two challenges basically: people have absolutely no idea about what is autism, and second issue is basically trying to find the right place for him to grow up normally and try to learn basic skills. I mean, Margaret, you've seen the report, and it's basically about French people saying that France, one of the most advanced countries in the world, the way it treats its autistic people is a scandal. That would leave you to ask what would be the case in places where healthcare program and system is poor.
So it is true that the challenges for providing services for families affected by autism spectrum disorder is enormous. Even in countries that have very good health care, early detection and understanding the differences between, as was characterized, poor behavior and judging of parental practices versus an actual disorder that really can be improved with the right kinds of engagement is a challenge. When you move to other countries that don't have a recognition or an awareness of this kind of disorder in place, or don't have the services infrastructure to manifest services, even if there were awareness, it's really quite a challenge. And you gave those worldwide prevalence numbers. In many places, we actually don't know what the prevalence is because it's so difficult to detect in systems where there's very few service options.
So, Mr. Shaban, why is it difficult to detect autism at an early stage? Because we've seen cases of people who were only told at the age of 15, 20, 25, 30, 40 that you are autistic.
Yeah, actually, it's because it's due to the availability of health services and the specialized physicians and psychologists in the field. Here in Qatar, we did a survey to find the prevalence rate in autism. So we did screening for 93 primary schools between the ages 5 to 12, and we found the results amazing. I mean, it used to be known as 3 per 10,000. What we found, it's much, much higher. It's almost equal to 0.9 to 1.2% among children attending the mainstream schools. Also, we extended our study to include all centers and hospitals providing services for the autistics, and the results were amazing. And as you know, Qatar is one of the leading countries in the awareness, and Her Highness Sheikh Hamoza in 2007, she started the Autism Awareness Day with the United Nations. Okay. So it depends, early detection depends mainly on the awareness and the
technology,
the availability of services.
Husna, is your child in a mainstream school, or is he confined to an institution for special needs children?
Yes, in a center for special need children, not a mainstream, because the severity of his problem is big.
It's a severe case.
Yes, yes, moderate to severe case, so we can put him in mainstream
Would
school.
you like to see him admitted in a mainstream school?
Of course. This is one of my hope, and I'm trying hard to work with him, to find the specialist to work with him.
When you say, just to help people understand, when you say you've been trying hard, is it because officials have not been receptive to you pushing for him to be admitted in a mainstream school to live normal life, or is it the bureaucracy here? If it's a severe case, then it has to be...
Not the bureaucracy, no. The main problem is his severity. Because here, allow the children to go to mainstream school if they are mild. If they are moderate to severe, it is not allowed to them to go to mainstream because they will affect all the education process. So there is a conditional for children to go to mainstream, and my children's severity don't allow.
Has there been any progress in his conditions since he has been
admitted
to that?
Yes. I work hard with him, and also the specialists work hard with him, and we put a good program. We follow him a lot, and we're trying to support him. A lot of progress. Since I come to Qatar, this is a surprise for me.
You've seen a change?
Yes.
In terms of learning basic skills like talking, reacting?
Yes.
Or is it still a challenge?
Yes, and the eye contact, because most of the children who has autistic, they have poor eye contact. The eye contact is good now. The focusing and the attention is become very, very high. So a lot of improvement happened to him.
Okay. Margaret, there's a problem here, basically, if you've seen our report. In France, a country where psychoanalysis plays a significant role in for quite some time, the view is that the best way to tackle autism is to confine people to specialized institutions where they can have decent life. Parents are saying, no, we would like to live with our children and we would like to try something different. We have two different views of how to deal with autism here.
So in the United States, this recognition that deinstitutionalization, that people with mental and behavioral disorders really can live rich, fulfilling lives out in the community and not in a psychiatric facility, has been the norm for many years here. And it's certainly true in the case of autism. There are, as you just heard, great strides that can be made through behavioral therapy. Now, that does not mean, as was mentioned earlier, that there is a cure, but it does mean that individuals can learn coping skills that help them to function in parts of society, and certainly that can get educational needs met, even in special educational settings, if not in mainstream educational settings. I would say that we wouldn't remove psychiatry from the spectrum of services that one could and should get. In fact, many individuals with autism do have other psychiatric conditions, but that does not negate the idea that moving to the community is possible, and for most individuals, a good outcome.
Mr. Shaban, you know this divide between the psychiatrists and those proponents of the applied behavioral analysis. Which one is mostly applied here in Doha?
In Doha, of course, it depends on the severity of the condition, but most of the centers usually provide the behavioral therapy, the other therapy, but in certain cases where the child needs certain psychiatric involvement, for instance, treatment or certain other medications, we usually refer them to the child psychiatrist. Otherwise, the intervention we applied here in most of the centers, like the Shafallah Center, the CD Center, Rumaila Hospital, they usually apply all these intervention and rehabilitation programs. And it seems that it's working and the results are very good.
Husna, I would like to ask you this question, particularly about the community. Do you feel like there's an awareness about autism? Do people understand the case of your child? How do they interact with him? Has it been difficult for you throughout all this time?
Actually, there are a lot of people who now they know autistic and they know the condition, and but we have to work hard. because most of the people who know the autistic have autistic children at home or they have relatives.
That's why they...
Yeah. So we have to work hard on community. Also now there are very good movement, women, the mom of autistic children now make association, and they are very nice. They are trying to get a right for their children, to get their service, which is very good beginning for them. And actually, I meet some of them. The most important thing, they have support from the government in Qatar. So this make us to have hope for future that they will make some difference in community and in society in general.
Margaret, in many places now, people the trend is to go for applied behavioural analysis. Many people believe because it fosters basic learning skills, the senses, the reception, it could potentially be the alternative for the future. Are you of the view that ABA is the future for people with autistic children?
So that's a difficult question for me to answer because I am not a clinician. I'm an epidemiologist who thinks more about the potential causes and studies how those treatments are implemented. But I will tell you that, I've certainly seen children and adolescents and older that have really benefited from ABA-type therapies. And this natural setting component, I think, really is a critical one for building skills that help with all kinds of life functioning. But I can't comment into too much further than that, given that I'm not a clinician myself.
I'll bring this question also to Mr. Shaban. ABA has been seen widely by people as the best tool to foster skills such as looking, listening, imitating, but also complex skills such as understanding other people's perspective. Do you believe that this could potentially become an alternative for families whose children suffer from autism?
Actually, it's not an alternative. It's part of the full intervention. Actually, first the child will be evaluated to see whether his communication skills, his social interaction, and the intellectual disability, whether, and then they will get a plan for him for intervention. And the ABA here plays a very important part for to give the best results available.
Husna, dealing with a child with autism is a real challenge. Yeah, but then navigating through the complex daily life is also another issue. We have to take them to good institutions, good schools, think about their future, see them hopefully in the future have a job, interacting with their community. You think this is something that could potentially happen in the near future and that the elements are there to make it a very smooth transition for
I wish this will happen in the near future, because I saw a lot of family which has older than my son, older autistic children who is he is autistic and older than my son, and they are now without any good service for them. So I don't want my son to be reached to this stage which no service. Stop, and you have to try by yourself, by try or by fault. Maybe you will do it by yourself correctly, because no institute dealing with older children, with adult autistic children. So I hope this will be the movement of government and the movement of community to interrupt and work together to solve this problem as soon as possible, because a lot of families suffering, and at the end they are member in this society. We have to take care of them as any human being.
Margaret, are we prepared to cope with the growing number in people with autism worldwide? Do we have the infrastructure worldwide, the know-how, the facilities, the treatment to cope with this? Or do you think the red flag should be raised?
I would agree that we don't yet have the facilities that we need. As we've discussed, we aren't great at even being able to detect children with autism. And as was just mentioned, children with autism become adults with autism. And we are all just learning the importance and the ways in which we can integrate adults with autism into our communities by providing the right kinds of secondary and post-secondary schooling, by figuring out the right kinds of employment opportunities, by figuring out the right kinds of housing, and how to take care of the physical health of individuals with autism. So there's so much to be done from the very early stages of life all the way through the life course. And so I'm optimistic that these questions are now being raised and that attention is being paid to them. But these are critical areas. And so, I would agree with the red flag idea.
Mr. Shaban, as a researcher, this is something that creates loads of anxiety for families. Autism is not the same symptom for the same case. You have Tourette syndrome, you have hyper-attention deficit disorder, you have coordinated movement disorder, you have hyperactivity, and people now are struggling to cope with brain disorders that are taking different shapes. Isn't this an indication that we are getting into a new uncharted territory, not only for families, but also for you scientists?
Well, autism, disorder or ASD, it's the problem. You cannot say that this case of autism is similar to the second one because of the so many comorbidities and so many other complications that comes with the disorder. And that will be a real challenge for researchers, for physicians, and for psychologists, for everybody. But everybody is trying their best to find solution. For instance, Hasna mentioned here in Qatar. In Qatar, actually, we have the Shafallah Center for Children with Disabilities that deals with older children, and they have a program to try and, to deal with those grown ASD till the ages of 21 and try to train the family so that how to cope with their adult or teenage after school, and to involve him in to find an occupation that fits his ability, etc. So it's not easy. And the other important things which I need to mention, now there are technologies in the early diagnosis of ASD, and one of them the eye tracking technology. Now we are trying to a research project done in many parts of the world, among them the Cleveland Clinic, and now we signed an agreement, collaboration, and we are going to start this in June. And the importance of this, it can detect ASD as early as 6 months.
I see your point.
Yeah.
While we're doing this show on autism, we also have to think about places where people have absolutely no idea about the problem. There's no infrastructure, no healthcare system, and people live and die without knowing anything about this this disorder. Hasna, we care about our children when they are children, teenagers, but then the care and the anxiety about the adulthood is something else. What do you think should be done now? Enacting new laws?
Yes.
That would help people like you cope with this huge challenge.
We need center for older children to take care of them. We need gym, especially for children autistic, for support them to go outside. We need especially special places for them to entertain them, because they can go outside. They have to go places. They can draw, for example. They can do anything they like it without looking from other adult or other member in society. We have to try to find the gift. Some of these children, they are very clever and gifted.
Very gifted, yes.
Yes, so we have to try to
tap into that potential.
Yeah, yes. And also it is possible to find places to put some cases. Okay.
Thank you. I really appreciate it. Thank you very much indeed. Looking forward to seeing you in the near future to continue our conversation about autism. Thank you very much indeed, Hasna Aweda, Margaret Daniel Fallon, and Fuad Al Shaban. Looking forward to seeing you in the near future. Thank you. Thank you for your presence. And thank you too for watching. You can see the program again anytime by visiting our website aljazeera.com. For further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Hashim Al-Bara, and the whole team here. Bye for now.